Which topic do you feel are the most crucial while preparing for the exam?
The fundamental of nursing is something that which is, I can say, a boring concept. I can say this is a must thing for every nursing person who is an aspirant for NCLEX.
What are your views about the NCLEX preparation course by Academically?
Academically is basically focusing on the feedback of the students.
So what is the salary differentiation that you think is there comparing to the different countries? So, hello everyone, and welcome to Academically. I'm your host Sunidhi, back with the promise of an engaging and highly informative session for you. All of us are aspirants trying to achieve something or the other in life. However, this live session is specially created for NCLEX aspirants, global nurses who are trying to migrate to Australia, the USA, or Canada by taking the NCLEX exam. Today, we are in conversation with Neha Vasudeva, an established nurse, a nursing educator, and Academically's faculty for NCLEX. Neha ma'am completed her MSc Nursing in the year 2013 in the specialty obstetrics and gynecological nursing, and she is also currently an educator and has 10 years of experience attached to her name. So congratulations on that, ma'am. And Neha ma'am is also a member of several esteemed organizations such as Society of Midwives membership and the Trained Nurses Association of India as well. So thank you so much, ma'am, for joining us today, and it's really a pleasure to have you here with us.
I'm really glad for that.
Yeah. So, ma'am, I'll just, start with the very basic question, like, why did you choose nursing as a career? And, how did you feel about your decision from then?
As I talk about my career in nursing, so since childhood, I was very passionate about helping others.
Yeah.
And like we live in India, we live in a society where helping is always done by the other people. And basically, near to my neighborhood, there was my auntie. She was an hypertensive patient. I used to take care of her every day. And from there itself, I was totally involved in helping her. I always wanted to enter into a medical profession. But as I grew up, I came to know about nursing profession. When I entered, like in the year 2006, that time nursing profession was not at its hike, but there were the chances, and I came to know that it has a very good professional output. And as a nurse, we can directly come in contact with the patients. We are the first line workers that who comes in contact with nurses. So at that time, I stepped into the nursing profession. I make it my means I can say it is my passion now.
Yeah, and that's really great, ma'am. That's 110% a great field to choose. So, ma'am, moving forward to my next question, why did you choose why only nursing? Like there were other healthcare sectors as well. So, what the opportunities did you get from this particular field?
Like in nursing, nursing is not a broad concept. Nursing is something which is totally comprised of helping the patients at the first level.
Yeah.
And moreover, as the nursing grew in today's modern era, in the modern nursing, we can say for its concept, the nursing has a profession, and we can be an educator, we can
Right.
be a forensic nursing. We enter into a forensic nursing aspects, and moreover we can be a clinician, nursing officers. And now I was upgraded, and now I'm working as a principal in one of
Yeah.
the reputed institutes. So in the clinical area setup as well as in the education, so it has a broad concept.
Mm-hmm.
This is the main basic point behind nursing, that I stepped into it in this profession. And
Yeah.
moreover, it holds a very crucial and good role. It gives a very financial support to one person who enters into a nursing, and if they move to abroad as well.
Yeah, ma'am. So, ma'am, how long have you been tutoring for NCLEX, and how has been your overall experience in this?
I started my NCLEX coaching in this year itself, in the month of May and June. One of my student, she came to me, and she was my very old student from the last institute. She came to me just for a guidance that, ma'am, I want guidance regarding NCLEX. That time I was preparing NCLEX for myself. And whenever I used to teach any topic to the students, because currently I am working in Punjab. So here there is a concept that everybody want to move to the abroad, basically the nursing students. They stepped into nursing because they want to go abroad. So I always take up a topic. Whenever I complete that topic, I used to tell them that refer this book, and I used to give them lot of MCQs. So at that time, I used the same concept with that student whom I have taught for the NCLEX for the first time. And after that, from the last 6 months, I got 2 students, 3 students, 4 students, and many of them have cleared the exams also. So
That's wonderful, ma'am. Yeah. So, ma'am, I would also want to ask you, like, as you said that, you have been teaching a lot of students, you have been mentoring them, guiding them. So, what
Yes.
is a unique point in your teaching approach, that can benefit students the most?
Like I am a teacher, and I
Yeah.
am a teacher by choice. It's not by a chance. So I always used an experiential learning approach for teaching my students. I always give them concepts, because in NCLEX, it is a competitive exam, and one can clear this exam if they know that what is the basic core concept behind that area. So
Right.
I always give them experiences. I always give them case scenarios, case studies, and I give them lot of experiences regarding the practical portion.
Yeah.
Sometimes I used to bring the artificial, this we can say simulators at home also to teach
Hmm.
my students, so that she'll be more comfortable with it. And if there is something like some bones or something, I used to show her PPTs, PowerPoint presentations. I always make her concept clear.
Yeah, and I think, ma'am, that is amazing because being a student, you would always look for such kind of mentors, who gives you the practical knowledge, because I think it is very important to get that practical knowledge with that theory knowledge, it's very, very important. Yeah. So, ma'am, moving forward to my next question, what do you think that, how should students assess their strengths and weaknesses in their NCLEX preparation?
Um, in their NCLEX preparation, basically, I always want my each student means clarify their concept first, go
Mm-hmm.
with the base, and talking about their weaknesses and their strengths. Sometimes what the student do as their strength, if they are clearing because there are variety of questions. Like in the MCQs, there are SATA questions, there are questions related to off for the wrong one or off for the right one. So if they're clearing the questions once, if they're getting the right concept of the questions, so at that time, that is their basic strength. They find it very easy, and they will go on with the same type of questions, and they can clear the maximum questions in the less amount of time. But their basic weakness is behind not grasping the right concept for the questions. That is their basic weakness, because at that time, if they are not holding the right command over the questions, so they can opt for the wrong answer.
Okay. And ma'am, like, how do you ensure comprehensive coverage of the NCLEX content? Like, do you focus on specific content areas or go for a holistic approach to the entire exam?
From my view, basically, I always want my student to cover at least the whole concept at least once. If they will complete the whole concept at least one, or the whole coverage of the syllabus, so after that, I just give them a simplified view of the content from which maximum questions can be put in. And they can have variety of questions after solving the whole concept. Because in NCLEX, if a person is practicing on an average of 30 to 40 questions at least a day, so it made them very easy. Suppose if we are taking any one, for example, gastrointestinal system, if we are taking that concept, and we are working on it. And I have chosen only 5 disease conditions which I taught them. So we can solve online and offline a lot of questions on that, so that we can cover the whole content at once for clearing the concept, and after that practicing over and over the time for that same concept.
Okay. And ma'am, when we talk about NCLEX, which topic do you feel are the most crucial while preparing for the exam?
If we talk about NCLEX, according to me, solving the SATA questions,
Yeah.
and that is select all that apply. Because in that, if you have not selected at least, if there were 4 correct responses, and if you have not chosen any one correct response, your whole answer will be wrong. So that gives you a negative point. And moreover, the concepts like assessment, sometimes it's the questions are so real to the real life experiences, like then at that time we get confused, and we don't prioritize the things, because what we think that this might be the right answer and we just correct because we want to solve the maximum amount of questions. This is the concept of every student who is attempting the NCLEX. So at that time,
Yeah.
prioritizing the questions and SATA questions and assessments and questions related to pharmacology, aging, fundamental concepts, which these nursing students have cleared the concept in their first year of BSc. So they
Okay.
have a long, huge gap. So they don't want to, means the fundamental of nursing is something that, which is, I can say, a boring concept in the nursing. So
Yeah.
I think these are the difficult points. These are the
Okay.
core concepts.
Yeah. So, ma'am, moving forward, can you share any success stories from students you have coached who have passed the NCLEX exam?
Yes, I want to share the story of one of my student from Noida, Ritu. Uh, she got married last year, I think. Last year she got married, and she has attempted NCLEX first time in the last year in the month of September after she got married. She got coaching also, but she called me and said, "Ma'am, from the day one when I have not cleared my exam, I was thinking to call you." And she called me and said that, "Ma'am, whenever you have time, at least give me a coaching." So I know that she was my weakest student of the class. She was not, at that time in the nursing itself, she has done GNM. She never used to clear her concepts. She just directly go to the questions. And the same thing she did in this NCLEX. So that was very challenging for me. I find it a challenge for myself that I have to teach her and I have to make her NCLEX exam clear. And during my coaching, when I was mentoring her, she never feels to clear the concept behind the question. She will directly read the question and jump out on the answers. And it will, every time it will be wrong. And she will say, "No, ma'am, this time also I will not clear my exam." I gave her coaching for 4 months because she was having difficulty in 1 month, but we can generally complete in 3 months itself. So at the last, from her exam date, I think 15 days back, I used to
Okay.
give her online questions and offline questions. And after that, successfully she completed her NCLEX and cleared the NCLEX. And she
Yeah.
was more than happy, and I was more than happy than her.
That's really amazing, ma'am, because obviously somebody is trusting you so much. The moment of happiness will be something else, because the person who was not able to pass the test is achieving that is a big thing. So yeah, obviously congratulations on that, ma'am.
Thank you.
So moving forward, ma'am, my next question would be like, what according to you is the importance of practice tests, and how should an aspirant approach them?
About the practice test, I can say this is a must thing for every nursing person who is an aspirant for NCLEX, because we can clear the concept, we can have a good base of NCLEX, we can have a good base for certain topics, but again, I'm telling, if we will do at least 30 to 40 practice questions in a day. This will give at least within a 3 months, they can hold a good knowledge and they can hold a good view about how to go for the NCLEX questions, because there are variety of questions. We can't say like if it is MCQs, we have to choose at least once. Practicing more and more will make them perfect and will improve their knowledge, that it will give them confidence of doing the questions. It is not only like practice questions. Yes, we can give them practice questions by ourselves, like offline mode, and from online mode there are certain apps and there are certain applications which give a paid applications also and non-paid applications also. They provide a good certain amount of questions in which they can have variety of questions. And recently itself, from the last 2 tests, the NCLEX has added different variety of questions like case studies, drag and drop types. So if they will practice more, there will be less error in their final examination.
Okay. Yeah. So, ma'am, what do you think is, the top mistake that most aspirants make, and, how can they avoid that at any cost?
As I previously said, from my experience, I have seen students misinterpreting the questions. They are not reading the questions properly and just jumping on the answers. This is the biggest mistake, first mistake they are making. And the second most mistake they are making it, like if we told any student like prioritize, or the basic mistake behind the questions is for the prioritizing the answers or prioritize the nursing care, they always opt for the easy one. Like suppose for an example, if I say there is 3 options and the third option is the nurse will not do anything and she will walk out of the room. If they will not understand, they will just directly jump out on the C option. So this is the biggest mistake. They always choose the easiest one. They always take a odd one out and they opt for that answer. This is the second mistake, and I think they should concentrate on reading the question first.
Yeah. So, ma'am, as you are the faculty of Academically, what are your views about the NCLEX preparation course by Academically?
NCLEX course by Academically, like Academically is a very good platform for variety of courses, and they are providing huge courses in every aspects. And according to me, they are providing a best bundle of questions. They are providing a best notes for the students, and they always use a right strategy, best technique, and moreover they are guiding the students in a smartest way, like using new technology and providing them a good environment. So I think this is the best thing for Academically, what they are doing for the students.
Yeah. So, ma'am, how do you think are we as Academically different from the other organizations in terms of the courses, preparation? Just a brief. Yeah.
From other point of view, if I want to differentiate, I have seen other institutes as well. There they don't basically everybody focus on getting a student input, getting a huge amount of student. But here we are focusing on the students, their core concept, their lacunas and their problems, because Academically is basically focusing on the feedback of the students. And when the student gives a good feedback, and if they find it difficult, so we are having one-to-one interaction. We are giving our valuable time to the students. We are giving them the best for which they are paid off. So that is why this is the basic difference in Academically, that they are using it in a smartest way, teaching the students in the smartest way.
Yeah. And guys, to contact us, you can directly connect with us on our websites, on our different social media platforms. We are there on Instagram, YouTube, and we have so many courses that you can definitely come and connect with us, and we will be happy to help you. So yeah, thank you, ma'am. So moving forward to my next question, ma'am, as you are a faculty of NCLEX, so what is the difference of the salaries do you think is there in terms, country wise, as you are in India
Yes.
and you are, preparing students for NCLEX. So what is the salary differentiation that you think is there, comparing to the different countries?
Firstly, talking about India, in India, like in the private sectors, nurses are not holding a good, wholesome salary. They are paid the basic wages itself. But as they move on to the other areas, like in the government sector, they hold a good salary. Round about the nursing officer nowadays in a government sector, they are getting good grade pay of 70 to 75,000 per month. And in the education sector itself, the nurses or the nurse educators or the nurse tutor, they are getting the basic pay. But it all depends upon in which sector we are working. But there is no doubt indeed, like the nurses working in the abroad, basically in the Saudi areas, in Canada, Australia and US, there is a huge salary. They are good, getting a good handsome salary. Like in Canada, for an hour they are getting they are paid of 45 to $50 an hour.
Oh,
Yes,
that's great. Yeah, that's great.
45 to $50 an hour. In US also, the same salary package is there. And in Australia also, they are getting round about 40 to $45.
Yeah, that
So
is so great.
yes, this is very true. And moreover, they are working for 8 hours in a day,
Shift,
and they
yeah.
are working for 4 days. And in US, one of my close friends, she is working in two hospitals as a staff nurse. She has cleared the NCLEX. Now she is an RN there, and she is working in two hospitals, evening and night shifts. And they are, moreover, in the abroad areas, there is a respect and dignity for nurses are more. This is the basic concept,
That
because
is,
if we talk about
yeah.
salary, that is yes, that is one main component, but for a job satisfaction the dignity is must. So that is more.
Yeah. That is great, ma'am. As you said, that just for an hour they get $40 to $45, and I think it's a huge difference from India.
Yeah,
So
true.
definitely, guys, if you're looking out to move to abroad, to migrate, settle for any healthcare profession, you can contact us. So yeah, ma'am. Coming to my last question for the session, any advice or tips you would like to share with the NCLEX aspirants, or any message you want to convey to them?
Yes, those who want to clear the NCLEX exam, this is a competitive exam that will give you a very bright future. I just want to say that you have everything in your head. You have all the concept in your head. You have cleared your nursing. You are very means passionate about nursing. Then only you have cleared the whole 4 year nursing course, or in GNM 3 year nursing courses. So I must say, just utilize that knowledge. Just brush it up. Come to us. We will guide you. We will help you. And just some few technique, skimming the areas and getting a good concept out of the whole bulk of knowledge that you have in your head. So how to solve the questions with the full confidence and zeal. This is all what I want to say, that just use your knowledge at the right time and be confident, and just help yourself to get a good future.
Yeah, ma'am, a lot can be understood from your answers, and all the NCLEX aspirants watching us will understand how amazing you are as an NCLEX teacher and a nursing professional as well.
Thank
And
you.
of course, and as an individual. So, now, ma'am, now it's time to say a goodbye to our viewers. And I request you all to visit our website 100% and follow us on academically.medcare for more NCLEX preparations, courses, details, everything. You will get all the latest updates on APC and NCLEX exam. So yeah, I hope this session has been an informative session for you all, and we really promise you all to come up with more such sessions. So yeah, thank you so much, ma'am, and thank you everyone for watching us. Don't forget to hit the like, share, and subscribe button, and comment down if you have any other queries. Thank you, ma'am. Thank you so much.
Thank you.